Jackie Katana. I'm the founder and executive director of Faith for Family Health Initiative, 3FHI. 3FHI started in 2017 with a seed grant from Bill and Melinda Gates Foundation, by then through Population Action International, PI. It resulted from a project which was implemented in 8 districts. It was called the Technical Assistance Support, and the model proved that if religious leaders are capacitated, they are mobilized, they can be catalysts of change, they can influence policies, but they can be able to ensure that the population accesses better healthy services. The registration of 3FHI was to consolidate the model, which had proved that it has a very good aspect of strengthening the interfaith-led and the multi-sectoral engagement. Currently, 3FHI is in 31 districts at national level and also global engagements, especially in advocacy. Our focus areas are to create a conducive environment for policy and financing in healthy aspects, to support or ensure that there is access, mobilize communities and demand generation for healthy service delivery, and to ensure that our mandate and vision of better health for all is achieved, and also overall to ensure that we have better health through faith and also better well-being. Right now, we've been able to also ensure that we advance towards our bigger mandate, the vision where we started from. Many people ask why all these blocks that are on our logo. The vision of 3FHI is to make sure that this model is rolled beyond Uganda, East Africa, Africa, and globally. And we've been able to see quite a number of achievements. Apparently, we've been able to advance quite a number of policies, influence financing for health, and the increment right now we see in the healthy financing or health budget is as a result of the engagements of 3FHI directly, but also Faith for Family Health Initiative is a civil society leader. Right now we represent civil society on the Health Policy Advisory Committee of Ministry of Health. We chair the RAMCA plus NCSO platform. We are member of a number of platforms, including PMNSH at global level, RHS at global level, and we've been representatives of civil society on the World Bank Global Financing Facility Investors Group, and right now we are members of the GFF Civil Society Working Group Steering Committee. So through that leadership, but also through our own engagements and projects that we've implemented, we've been able to see increased service delivery access, and also access to service delivery, and also been able to mobilize the different interfaith leaders and also sectoral actors to ensure that they are able to advance better health and well-being for all.
We, the Faith for Family Health Initiative, hold the view that if faith leaders are mobilized, capacitated and engaged, their voices and actions documented and amplified, then they can become a catalyst for behavior change, effective agency for healthcare delivery, and indispensable actors for health policy influencing, thus contributing to better family health and well-being. Convening power. Bishop Stephen Kazimba integrates family planning in religious structures during the Uganda Matters Day commemoration.
This has nothing to do with the one denomination. It has to do with all people working in collaboration, communication, coordination, and connection.
A platform and influence. Deputy Mufti Sheikh Ali Waiswa gives the stand of Uganda Muslim Supreme Council during the 3rd National Family Planning Conference.
Muslim religious leaders made a consensus on this subject, and we wrote out publications as guidelines to guide our clerics and at the lower levels to be able to address issues of family planning.
Focusing on 8 districts: Metiana, Mubende, Chenjojo, Iganga, Kagadi, Namayingo, Kabarole and Busia. A number of achievements have been made. Allocations to family planning stand at 864 million Uganda shillings. District-costed implementation plan 6 have been launched, 1 approved and 1 drafted. Health executive and civil society engagements have increased and been strengthened at district level.
Most districts anyway, they have not taken family planning serious, and the amount of money dedicated to that area is little or not there. So those responsible for the budget of Uganda, for the districts to look into that, because that is an area which is going to help us now.
I am also known as a champion for family planning, as you saw boys, and I'm not complaining because I have girls now.
Does God allow us now to have as many children as we can? This is where we are supposed to work as religious leaders, as leaders in our societies. We are supposed to help our people look at the dynamics of society, look at the economic challenges that we face, and advise our people accordingly. If you cannot afford a large family, yet get your children when you can afford them. My conclusion therefore is, you must plan your family, you must have children at a time when you can handle them, so that the issues of transformation come. God is a transformer of societies.
And harmonize healthcare prices across the country to save especially the indigents.
And the way a Panadol would cost me in the hospital, government hospital, is not the same way it is in the black market or in the pharmacy. To the extent that I have even to call some people at home that please sell even the little coffee which is there. So, the way we are spending money on medicine, it is too much.
Some people are telling you they have sick people in the hospitals. Some of them are being held because they can't pay the dues. Yes. So we end up doing what we can. Sometimes we contribute a little, and then we do the best, that is praying for them, for God's intervention.
Nobody at this stage can pay their hospital bill at any given rate. No one. I don't know anyone. But the point is, when there is no insurance cover, then the cover has to be borne by those around you.
But the first ever crucial enabling bill is still pending assent by the President since the 31st of March 2021, when it was passed by Parliament.
We'll allow policies that help the people with this burden.
It guarantees life for our people and for our future generations. A healthy country will always develop.
I am tired of attending funeral services, and we say it has been God's will to take away this person. Death can be postponed.
In fact, we are late because people or hospitals, because they know they don't have money. Others who have gone to private clinics, they have been given bills which they even don't know what to do with them because they can't afford the bills. So with health insurance, all that would be taken care of. Nobody would be worried about what to do when...
Number 3, which means that everyone should access health services. So when you get this scheme, this new financing mechanism will help our people to achieve or to get the health care, even those who are poor. So I think when we start this scheme, it will be so important to everyone in the country.
Yes, we want a good economy, but economy is going to be spearheaded by people who are living, not dead people. So life saving should be given priority. To His Excellency the President, we say, yes, Your Excellency, you are doing enough, you are trying. Even during the lockdown, you guided us well, but to be permanently sure that the lives of Ugandans are protected is you to assent to the National Health Insurance.
They request him kindly to definitely sign this bill to become a law.
At FHI, our mandate or vision is better health and well-being, with focus on women, children and adolescent health. For the last 7 years, working in 20 districts at national level, we've been able to improve services, influence policies for women, children and adolescents.
Thanks to FHI, I've gained the support and the skills to overcome challenges like peer pressure, which had affected my education. I'm now one of the most confident university students and a resource for the other girls about reproductive and mental health, and in the community where I serve as a role model and a change point.
Girls like Novia from Toroko districts now studying at the university represents the many champions that we've trained for over 7 years in adolescent mental health and the entire well-being of community. We use or work with them to pass on messages to the docents and the community. At FHI, we are changing lives. One woman, one youth, one community. Join us as we advance health and well-being of women, children and adolescents.
Our topic today is investing in adolescent matters. Improving the physical, mental and sexual health of adolescent aged 10 to 19 years at the cost of $4.6 per person per year would bring a tenfold economic benefit by averting 12 million adolescent deaths. Let's look at the budgets now. Is there a deliberate move to secure the future of our young ones? So there is a weak prioritization of adolescent health implement programs and the budgets. There is lack of leadership and the life skills among adolescents. Friends, on the question of what needs to be done, I'm quick to observe that the faith community are recognizing the importance of providing safe environment for younger people. All places of worship, we say the mosques and churches, faith-based schools, are places where moral values are formed and strengthened. Self-esteem is cultivated and life's lessons are taught using the holy scriptures, that say the Quran and the Bible.
We have come a long way, but there is still a need for more progress, especially in the area of reducing teen pregnancy, early marriage, and preventing gender-based violence. Where the concerns of the church overlap with the development agenda of the UN and NGOs it funds, we shall join together in a common cause. For example, like the UN, we are very concerned to improve reproductive health in Uganda and to reduce maternal and infant mortality. Surely our youth need better sexuality education.
According to me, should allocate enough funds specifically for the children, women, especially mothers who deliver in problems, and also have a full-fledged budget for these, for the antenatal, for the adolescents, and for women, because we discover that many women are dying while giving birth, and there are so many adolescents, the girls who are being raped. There are those who are getting pregnant when it is still early because they lack knowledge, they lack information. They have not been told that there is anything like abstaining. The parents are not strong on giving them guidelines that can help them really to stand on their own and say, excuse me, it is not time for me to involve myself in sex, to give. Yeah, personally, I try my best to educate the community and the believers who come to church. I urge also the other religious leaders and the stakeholders, and of course also the government, to help the religion, to help to voice their issues, to also to share with the religious leaders, so that, because the religious leaders have got a lot of information that they can give to the community, but sometimes they are not well facilitated, or they don't have access to this information. And in most cases, they also do not have a chance to go for these seminars that they can help them, and sometimes they are not approached. People maybe think they do not have this information.
By a select committee of parliament in 2019 revealed that 77.7% of primary school children experience sexual abuse while at school, while 82% of students in secondary school experience sexual abuse, of whom 8% had been defiled.
Yeah, even though government has done its part, there is still a lot that talk about money. Someone runs away and they never come back to report.
We nafuna olubuto lw'ono omwana era yandepinga bulepinzi kubanga yajja kiro, yandepinga kubanga twali tetwakiriziganya ku eyo mboozi mbasagala girowoozaako, aliwo wempulira n'obusungu ng'omwana nyi.
The future of promising young girls and children has been shattered. Some have died, others have survived to narrate their ordeals.
You see, such a kind of situation, we have weak laws. We need to strengthen those laws, and we need to see culprits being punished.
The reality of how big the challenge is in the Ugandan society is seen through spiritual leaders to whom many victims run. Others die in silence.
While we're discussing this, we need to know how much supplies do we have and how much products do we have to address the issues of family planning.
I'd like to remind you a few issues regarding the policy dialogue on holistic financing for family planning supplies in Uganda, and issues that we have been discussing throughout the last year events, which are very important to continuing to pursue issues related to family planning. Of interventions using a multi-sectoral approach at the national and subnational level. Regarding financing for family planning commodities, as part of the Family Planning 2030 Global Partnership, Uganda launched 6 commitments at the end of 2021 as a pathway to achieving the targets of increasing the modern contraceptive prevalence rate from 39 to 50%.
We keep reminding them that you have made a commitment, but how do we support them to fulfill that commitment? We are not auditing them, but we are working together. We want to ensure that we have that mutual understanding, mutual relationship to engage them to fulfill those commitments. So the study was looking at where are the gaps.
It's really for us to be able to implement the national health insurance as part of the financing strategy. So I would want that as we put advocacy and accountability, we should also be able to push advocacy on the demand side so that we can have resourcing equal.
Mortalities that we see in our country. We acknowledge that family planning plays a central role in improving the health of mothers, infants, and it empowers women and reduces poverty. Third, we recognize that through various policy instruments, government of Uganda recognizes the importance of investing in family planning to facilitate scaling up, access and uptake of family planning services and all the other commodities that come along with it. We as political leaders, we commit to ensure that government fulfills the policy commitments. We need to look at the focus of our accountability should be at 2 fronts. One, increasing domestic allocation, which I really see, the pledges, the commitments, the declarations are quite strong on that. But I haven't seen so much on how we can also better and more efficiently use what's being allocated. I think the conversation has skewed a bit to the first, and we didn't dig that, a bit deeply into the second, and yet that's also very important.
But also we will leverage on our considerable know-how of using diverse communication channels, methods including our media outlets, publications, illustrations, to influence political decisions on RAMNAC investments, budget allocations, and accountability. For implementation, we are looking at full implementation of RAMNAC sharpened plan. Objective 1 is strengthen leadership and coordination of national RAMNAC coalition on overall RAMNAC plus N funding in Uganda, and especially implementation of sharpened plans. We all know that we've been doing this. We've even had a study that Patrick did, trying to track and see what is it that has been done and the resources.
MNCH Youth Summit, or in other words, we can call it the Pre-Safe Motherhood Conference, and it's a discussion we're taking up with the Nagurutin Information and Health Center. And our colleagues from Butaleja organizing the National Stakeholders Consultative Meeting on Adolescent Health and Wellbeing. That is a leading event to the 1.8 billion global campaign by PMNCH, nationalizing the regional forums in Western, Eastern and Northern regions of Uganda. And
responding to GBV, and then also identifying capacity gaps for the forum and forum members. And lastly, we came up with recommendations, what we think we can do, and we formed a resource mobilization committee, which is again some of the members we have agreed on here are part of that resource mobilization.
A functional steering committee, that's not a lot of money, we cannot now pool resources and a steering committee. But what worries me, we don't have money to convene our members physically on a quarterly basis. And that's where our strength is. Now, for us who are saying that we are going to do a webinar, webinars might not work for our community members. We will try, it's something, it's an innovation, but we need to look for money. And this if we can't do quarterly, let's do biannual, where all our members come and we're able to pick those issues. The other one that is also, I see clearly, we've been tracking finances, the studies that we've had. Now, Patrick is about to share one with us. You already shared, but maybe we'll disseminate it at some point. If that study is done and there are gaps and recommendations, and we are supposed to engage, at some point after some time we are supposed to be doing more study, another study, and more studies, because accountability is about evidence.
As religious leaders, we are entrusted with a sacred duty to nurture this heritage, body, mind, and soul. Immunization is a powerful tool, a gift from God through the efforts of the Uganda National Expanded Program on Immunization, UNEP in brackets, protecting our children against 14 preventable diseases, including polio, measles, and rubella, by uniting interfaith leaders, Catholic, Protestant, Muslim, Orthodox, Seventh-day Adventist, born-again, and cultural leaders of Buganda Kingdom. We can restore trust, counter myths, and ensure every child is vaccinated. Our role as faith leaders is clear. We must use our pulpits, our pastoral networks, and our community platforms to champion immunization as an act of stewardship and love. I commend 3FHI for uniting us across faith and sectors Recognizing that health is a shared responsibility, I pledge my support and call on all of us to sign a commitment statement, train champions, and speak boldly about immunization in our churches, mosques, and community gatherings.
Wakiso has interesting demographics. It has the refugees, fishing communities, it has the elites, it has the rural aspects, it has the slums. It's such a very complex, dynamic community, but we have the right strategies. We also add digital as one of the strategies that we are going to advance, and our main focus is going to make sure that we address the zero-dose challenge in the country, and Wakiso is leading in the country to have the zero-dose children and even those that don't complete immunization, despite the fact that actually the district has elites and disparities.
Their cultural perspectives are different. The language is another thing. How are we going to meet? And these are particularly in Wakiso district and also Kampala Central.
Of vaccine preventable diseases. The Kabaka Foundation has also led the strengthening of healthcare delivery approaches, health promotion, health education, focusing on early detection of management of non-communicable diseases, community screening and access to basic treatment in the underserved areas. But equally, the Kingdom has also constructed the health facilities. 2 are already operational at Kalasa in Bulemezi, and another one is in Nsanji. And hopefully, come next month, on the 1st, we are going to open doors for patients.
Because we use a multi-sectoral approach, that we use what we call interfaith-led model through multi-sectoral approach. That means we work with our leaders, the religious and cultural leaders, we work with media and all other partners. That enables us to reach everyone in the community.
But we know from our public health perspective that the non-health actors are very, very instrumental when it comes to promoting immunization. Historically, we know that the Kingdom of Uganda has been very, very instrumental in promoting immunization, not only here in Uganda, but of course also within the entire country. We also know that the religious leaders have been very, very instrumental. We really rely on the two. And of course,
members, the mothers that eventually come to the facilities, always interface with faith leaders. Sometimes they interface with you on a weekly basis, but they may come to the clinic or to the facility once in a month, maybe sometimes in a quarter. But you sit in a very unique place in that you get to see them on a weekly basis, or sometimes twice every month.
But what type of generation? We first put ourselves at a family level. When you die, how would you, if tomorrow you were to go back to be alive, you find things are disorganized. So as we live, and I like this preaching, that when it is still day, God was looking, and that's why for me I don't want it now translation here. I will learn Butoro or Butuku by force. That we should work when it's still what? Daytime. Because when it becomes dark, you will not what? When you reach a certain age, because like now, that's why the Bible said the youth, enjoy, but remember you are what? And I like that verse. Enjoy, do what God do what? But remember, you are greater. And remember that one day, you will become what? Weak. I like that preaching. And if everyone should be, for us there's a saying in that so they say, "Ekeremita." That your brain should be working day and night. Not that people who sleep and they don't even bother. That tomorrow what should I have? Now Christmas is coming. Women will start disturbing. Children will need meat. Children will need clothes. What are you going to do? By now you should not even be thinking of looking for money. The money should already be what? The food should already, that is it.
Today, we are here with our partners, Faith for Family Health, being mentored and being trained, brainstorming on the burden of teenage pregnancies, not only in Kanara Town Council, Kanara Sub-County, but also as the world, as a country. It is a big problem to us. So we are brainstorming on what we should do to approach this big problem that is eating up our community. And my concern as a health worker, I've come to realize that the problem has to be approached from the root cause. We have to know where the girls that get pregnant, the teenage girls, where do they come from? There is a lot that we have done to make sure that these girls catch up with the teenage pregnancies, to see that they continue with their education, to see that they prevent the fathering of getting pregnant again before they are ready. But we have not exactly looked at where these people stay and come from. It is true, as it is said by the Englishman, that charity begins at home. So whatever these children come up to be comes from home. So my point here is that we have to bring the families of these children on board. The family of the teenage mothers must be involved completely in this package of fighting and bringing to an end teenage pregnancies in our country. So when we go back, we need to go, as we sensitize the teenage mothers, we need to go and sensitize the parents from where these children come from, because sometimes they are pushed into these marriages by their own parents. The parents want to use them for money. We have seen cases, and you out there must have experienced cases, where a mother sends out her daughter for money, where a mother marries out a young girl of 14 and 15 for money. So the mother is not aware that a girl child below 18 years is not yet due for marriage, neither is her body well prepared to carry a pregnancy. So we have to bring this sensitization to the mothers, to the aunties, to the fathers, to the uncles, to the grandies. We have to come back down to the ground with these same girls, but look at the families from where they come from. In other words, we can fail to even save the other girls who are young, because they will use the image of their big sister as a role model. And they say, if she got pregnant, I can also get pregnant. And so many other people, we have put all efforts on these people, but we have forgotten the people who caused this problem. And that is the men. The men, if we would have a world where a man would not sleep on a girl who is below 18 years, then we would have put an end to teenage pregnancies in our country. So I want to implore, I want to make awareness to all men in the world, and from our Kanara Town Council to the entire country, that men should know that they have the extra role, they have the central role to play in order to bring an end to teenage pregnancies. If the uncles who come to disguise as helpers of these girls, if the friends who come to disguise as helpers of these girls, if the rich men around would come on board and know that I can fund and educate a girl child without sleeping in her beyond the age of 18 years, then we would put an end to early child marriages and teenage pregnancies. So I'm asking the entire fraternity to engage the man, to engage us, that we may build capacity from within, that we will not be able again to sleep and or have sex with girls who are below the age of 18 years as per our constitution. We have had cases of young girls engaging into family planning methods, engaging into incomplete abortions and sepsis and the likes of all those health challenges, simply because they have been impregnated by an uncle, they have been impregnated by a friend of their dad, they have been impregnated by people who are just around them. The Bible is true when it says that the enemy comes from within around you. I want to urge us all men, let us have something in our hearts that can help us not to have sex with these girls until when they are of age.
Amanya gange bampita Kabazaire Neema, ndi VHT, sub-county ya Kanaro sub-county. Tuli wano mu Kanara Town Council tuyina training ngaba VHTs oba wa health workers. Ne nsoka kwebaza project erese weno training kubanga tubadde tuyina bingi byetuyize mweno training ya uzazi salama. Ngafe ba VHT oba ba health workers tulina zi challenges zetusanze eyo gye tubeera. Naddala okuva amazzi gajja ne gakuba amataba gakuba Ntoroko district netufunamu obuzibu nga VHTs nga community bwe tutyo. Ekisookera ddala muno eno training ekwatagana n'abaana babuwala abafuna embuto nga tebannaba, abafuna embuto nga tebagadde naye obeeraawo n'osanga omwana ali lubuto ng'omubuuza kiki ebizibu alina bingi, alina answers nyingi ezaakuwa lwaki yafunye obuto ate bw'omutunuulira emyaka mito. So ngaffe ba VHTs tukoze ogwaffe era tukyagendera ddala mu maaso n'okukola ogwo omulimu. Ekisookera ddala challenge gye tuyina nga Kanara sub-county, kuva amataba bwe gakuba eyo sub-county ya Kanara, abantu ne bava mu maka amalungi ne babeera mu camps, tufunye obuzibu bw'amaanyi. Ekisookera ddala mu camps we tubeera tuli mu mataka g'abandi si gaffe, mataka tugapangisa, nanyini taka kupimira bupimizi taka woteeka akayumbako si nyumba nungi ekiri awo mbu oyinza okuteekamu ebisenge n'oyawula ekisenge kya taata n'oyawula ekisenge kya maama n'eky'abaana nedda ne bakuwa akataka ng'akatono mulimu okuteekamu buli kimu omuzadde n'abaana oba olina abaana 10 era mwena mugenda kutuula mu kayumba ke kamu. Kati ekivaamu bwe bwenzi obuyitiridde wakuba ono abakuwa osimbawo akayumbako n'omulala n'ateekawo akake n'omulala n'ateekawo akake mu space entono nnyo oyinza okusangawo amayumba nga 5 oba 6 kyokka mulina families. Kati ekiddako eri family bwetandika ensonga z'ekikulu n'endala neewulira n'ekiveera ekirala n'ekiwulira, kati ekivuddemu ensi kwonooneka, abaana bawala kwonooneka, abaana bawala bafunye embuto. Waliwo omuvubuka gwe n'abuuzaako ne mugamba naye gwe kiki ddala mu mwaka gumu ozadde abaana 3 abaana 4 in different mothers kiki? Naye answer gye yampadde n'angamba camps kyekizibu. Era naawe okirabira ddala nti camps kyekizibu kubanga edda twali tuli bulungi tuzimbye bulungi naye saawa zino buli omu ali mu camps kiveera ku kiveera naye tusanze obuzibu bw'amaanyi ku saidi y'abaana abawala. bw'omubuuza muwala ng'oli mwana muto kiki ddala ng'ofunye olubuto kyali mwana muto ansa gy'akuwa nti munnaaye ekisookera ddala abazadde bange tebeesobola nze ebyokusoma n'abivaako kati kyenina okukola okufunayo boyfriend okuzaala era ne mugamba nedda tekisobola kati nga nze nga VHT kyenyinza okukola era amagezi gembawa nga mubudaabuda ne mugamba kyokoze si kirungi yesu okuzaala kirungi naye wazadde n'emyaka yo tennabatuuka kati kyetugenda okukola ekirungi tulina Health Center 3 Lwangara Health Center 3 ne mubudaabuda ne mutwala ku ddwaliro ne tusangayo abasawo ne baddamu ne bamubudaabuda ne bamugamba kati sooka okuzono gw'omaze okukola ki okuzaala kubanga tetusobola kutta mwana w'omuntu era tulina omubudaabuda olumala okuzaala abasawo ne bamuwa amagezi either kukozesa family planning kubanga obwo obuweereza weebuli waliwo abakkiriza ne batandika obuweereza bwa family plannings era tetutudde ne tuddayo ewaka eri abazadde ne tubabuulira nti munnaaye kino si kirungi ono mwana muwala ono mwana mulenzi kati buli omu ne tumwawula ne tubabuulira nti kiki kye balina okukolera omwana omuwala ate kiki kye balina okukolera omwana omulenzi nga ku saidi y'abaana abawala naddala nnyo abaana abawala balina obbalabirira bulungi balina obbaweerera bagende ku masomero basome kubanga ye future yaabwe ezo embuto zetuzaala buli lunaku si future nedda kubanga alina emyaka 15 agenda azaala omwana naye maama mwana kati bona babeera baana so netubabudaabuda ng'abazadde nabo ne bakkiriza era nabo ne batwala responsibility yabwe ng'abazadde okubuulirira abaana bwe tutyo tugezaako naye nga mukama ye mubezi waffe tujja kyusa Kanara sub county neba bulungi.
When they get them, they use them outdoor. It's an expensive and irresponsible. So,
teachers, fellow teachers, ladies and gentlemen, I take this honor to thank this project for having brought us this wonderful information. My name is Dr. Badi Kapusa, the deputy head teacher in Kanara Secondary School. This information has come at the right time because we have been dealing with issues where we are lacking detailed information. For example, for us at secondary, the deputy in charge of discipline. By the way, we were managing the discipline following the school rules and regulations find that it was really contrary to what I have learned today. That we need to team up and put these issues into action. The words we have had today, if we go and put them into action, we're going to have better schools. We are seeing all the discipline in schools. I've seen that it is because we have not dealt with the root cause of this. Other issues come from homes, other issues come from among ourselves because we are failing how to handle, but let us go and implement. We're going to have this work plan, and for those ones in the town council, I promise I'm going to reach our schools are near, we're going to reach there, then I see how we're going to ensure that we implement. And for those in the sub-county, we're also going to be together on the same platform. I know that we shall have one mother WhatsApp platform that's going to be uniting us. We're going to be feeding each other with the information and how to go about issues and make sure we implement.
Alpha Karubu, the operations manager, Chabazinga Initiatives, at the same time operations manager in the Ministry, in the office of the Minister of Chabazinga Affairs. Today we are here with religious leaders and cultural leaders discussing about how we can help our communities. So for us as the Busoga Kingdom, we moved ahead. We are already implementing the mandate of the Chabazinga being a good rural ambassador in the fight against teenage pregnancy, early marriages, ending high school dropouts, using the term or the campaign Ambassador Empower, meaning men are the pillars. So in this campaign of ending teenage pregnancy, the Chabazinga guided that we look at the men as the head of the families. So as a kingdom, we are moving through all the 11 chiefdoms that make up Busoga Kingdom, going down to the sub-counties, going down the villages, such that every community is aware of what is taking place, knowing that as men, they are the pillars, knowing that they are the leaders of their families, they are the leaders in actually educating their children, they are the leaders in making sure that these children, especially the girls, instead of going to town centers in the evening where they are tempted, they are at home and they are in school. So the Chabazinga thought it prudent, after being nominated by the UN agencies, that we can reach out these men, such that this message for him to disseminate this message, it is through different platforms. For example, we can use the mosques, we can use the churches, we can use the different gatherings, the media, which are very crucial actually in disseminating the information. So as we move forward to making sure that this message goes down to the communities, we appeal to each and every partner, the religious leaders, the community leaders, local leaders. Now that we have partners like the Faith for Family Health, we urge actually such initiatives to take place in these communities, such that we can help the needed, the vulnerable. Being vulnerable doesn't mean that you don't have what to eat, you don't have what to dress, but you are vulnerable to any activity that can harm you. So these girls, these young girls and the children actually at large, they are vulnerable. So when we, as we work Chabazinga, when we say Ambassador Empower, we are meaning we are empowering the men to be actually the pillars. We are empowering the men to make sure that if you have your children, make sure they are at the right place in the right time, such that we avoid these challenges of so child is pregnant. So why would a child of 13, 14, as it has been depicted in the media, be pregnant? So for sure, it has actually caused a bad image. So the Chabazinga is working tooth and nail to make sure that this vice ends in Busoga.
I'm Bishop Egesa Stephen, District Bishop Born Again Faith, Bojiri District. I want to take this opportunity to thank God that we've had a 3 days workshop with the Faithful Family Health. We thank the government of Uganda for allowing such organizations to come up with the ideas that can support, that can help, that can mobilize, that can help the people as far as health matters are concerned. In the 3 days, we've learned a lot of things, but I would just want to mention that at least one of them that we've learned is about the issue of family planning. Now, in many cases, people have mistaken the word family planning for only the family planning methods or contraceptives. But at least we've learned that besides you having those contraceptives, there is a planning for the whole family. Therefore, we don't need to throw everything in the rubbish, but we have to pick out what we think is right in this concept of family planning. And not only that, on the issue of the youth, so many youth have gone astray simply because they lack information about their health, about their growth, about everything. And then we end up saying the government has not allowed the parents to discipline their children simply because we've not taken our responsibility as parents to guide the youth in the right direction. Now, the other part of it is about the pregnant mothers. In most cases, men have done a job of making sure they're getting children through these mothers. But when it comes to time of the gestation, when it comes to time when the mothers are pregnant, they need support. They need support in a way that they are weak, they're vulnerable, therefore they need the money's or the husband's support. So one of the things I'm going to do as a born-again faith leader in Bojiri District is to mobilize, to agitate, to make sure the men are aware of their responsibility in this area. Not only that, and we also need to take information to those that are lacking as far as health matters are concerned. Like the Bible says in Hosea chapter 4, verse 6, that my people are destroyed because they lack information, they lack knowledge. We want to go and disseminate this information that at least the people are not getting astray, people are not getting lost, people are not dying simply because they lack right information about the health matters.
By name, I'm called Pastor Valiko Samuel for Seventh-day Adventist Church, Jinja District, and as well as working in the office of Station Director. We have been here at Jinja Sisan Hotel. We have been going through a workshop of 3 days where we have learned the area of faith for family health, that is 3F, HI. We are so grateful that we have gone through a series of topics on health, and especially how we can take care of ourselves, actually self-care. We have learned on sickle cell, we have learned on mental health, we have learned adolescence, older person, and what I've learned I would like to go with as action points. We are supposed to take care of ourselves. Especially some people, they don't want to take care of themselves when it comes to sickness. People, they fall sick, instead of visiting the professionals of health facilities, they just consult wiki crops, they just consult even us religious leaders. They come to us for prayers, but I would like to let you know that when you fall sick, you need to understand, you need to know how to take care of yourself. Number one, go for screening, go for medical checkup, go for testing. That's when you can discover which type of sickness you are suffering from before you consult anyone for counseling. So it is very important to know your life stand, to know your life, how are you standing.
Hello everyone, I want to send a shout out to Faith for Family Health Initiative, Makerere University Public Health Department, and also in conjunction with Ministry of Health. We want to appreciate them for this opportunity they've given us to partner with them as religious leaders in a workshop that has been looking at self-care, self-love. We want to appreciate them that because each one of us, it concerns us. You are a victim or a victor of these areas. Remember one time when you really lacked self-love or self-care. The Bible, in the Gospel, we have the story. The Gospel of John, we have the story of the Samaritan woman who went to the well. And while he was at well, he met Jesus, who interrogated her. And at that point, it was a turning point. Beloved, we live in a world where many of us are victims of self-care and self-love. We deny ourselves, and yet this is part and parcel of us. So I want to call upon you that take a moment and offer yourself this self-care and self-love. In so doing, you are able to heal yourself and to reach out to the people around you. Through this training, we've been able to tackle a number of areas of concern in our community. Areas to do with non-communicable diseases, areas to do with adolescents' health, areas to do with the elderly and their health, areas to do with HIV and STIs, to mention but a few. And all these areas concern each one of us. As an individual, when you look at HIV and STIs, it is one area that robs you of your love, that robs you of your dignity. And so I call out to you all, let us be partners as we reach out to people in our communities, in our localities, in our congregations that are undergoing this issue of HIV and STIs. Today in our communities, thanks to the development partners and all well-wishers, we have opportunities where we can engage in self-testing. You can access it and do a test by yourself, or you can reach out to the various health centers in our localities where they can guide you. And when you are tested, be calm when the results come out. The health workers can help you digest the results, and also as religious leaders, we can stand with you in this journey. It is not the end. Let us reach out to one another, walk with one another, and remember that that is not the end, because hope is vital in everything that we do. I remain Reverend Canon Joshua Mutable from Busoga Diocese. Thank you.
And this one is to everybody, to stay informed about the health, about his health in all corners. That's what is meant by this gathering. We also need to practice self-compassion and self-awareness. We need to remember, my brothers, that self-care is a journey without destination. It is about making conscious choices to nurture our bodies, minds, and spirit. So we need to make ourselves to make self-care a habit, because always we are together with self-care, unless you make your lives careless.
Because when we talk about the region I come from, Busia, Namayingo, we see that the teenage pregnancy is very rampant in that area. So I suggest that. Thank you very much.
And you know, we are learning a lot. You know, there are things, you may have gone to a seminary, to a Bible school, to a theological school, but you have not studied this. But as you teach, we are integrating it. For us, we are now integrating your teachings into our ceremonies to make it easier for our people to learn. Because whatever we speak here is biblically written. I sometimes see people talking of women emancipation, talking of girl child. You know, these zungos are very wise. It is there in the Bible. It's there in the Bible when people are fighting for inheritance and another father had died with leaving only 5 girls.
To keep my brain active, and then I asked him, what can you do? And he says, I can be a security guard. And then I said, this is strange. And I was like, can you manage night duty also? Yes. I said, okay. Then when I sat down, I made a decision. I said, now for you, you are going to be during the day, where when we work, we see you around. And he's there doing. Now he has added the apostolate of praying. Sister, you go, look for money, work on the patients, but me, I'm here praying. So you find him with his rosary throughout at the gate. That's what I wanted to share, and I'm encouraging all of us. Don't ignore those people. They have wisdom, they have love. We have to keep them with us. Where they are is where we are going. Please let us support the elderly. Thank you so much.
Because we know that when it gets to culture and religion, there's a language you speak. So they review these materials, make sure that they are cultural and religious sensitive. And we are going to be asking you to give us more culture-related messages, more scriptures, more sulas, to make sure that the materials we use next time, they will not be speaking Daikoni Ministry of Health. They'll be speaking your language. So when you're going to train, we want to have the customized and aligned materials. And now, last week, we were in Jinja. We convened the first regional meeting with, again, the same congregation, 4 districts in eastern Uganda, and it was an amazing experience. But the only difference, we didn't have a king. So now this one is a masterpiece, isn't it? Yes. People of Eastern, people of Toro, can we clap and thank God? We rarely in our meetings get people like you seated, cultural, religious leaders of all faith, nuns, priests, bishops, pastors, and they're talking about things that concern everyone. So we are very grateful, and we don't take that for granted. On behalf of the board that is headed by the Deputy Mufti of Uganda Muslim Supreme Council and all the eminent religious leaders and the cultural leaders, we don't have a cultural leader on the board. Rosin, you help me. Next time we are coming up with an advisory board, we need a cultural leader. Tegem, that has done a lot of work in this region, we would not have gotten cultural leaders here. For sure, this is amazing, and we know that self-care in this region is not going to remain the same. And your prayers work. We've survived 8 years, and God is taking us to another level, and we'll continue to serve. Thank you so much.
I'm looking at self-care and antenatal messages. Yesterday, as we looked at it has to be support, but I had it also in mind, but the Reverend wrote it clearly, that not only supporting, but accompanying our wives to what? Health units. Why? Some time back, it was a must that if you don't go with your wife, they would not what? Attend on her. Why? Because they wanted to, because the numbers to reduce on the infection of HIV. So it is very important that we accompany. During my time when I was still active, I did accompany my wife. But now that I stopped, I'm retired. My I took the bishop talked about the queer behaviors during pregnancies. But here, let's remember that every pregnancy comes with its own complications. When the pregnancy comes, there are those who are, they change, women's change in behavior, what others are rude, others are so loud that they don't even see you move away from them, isn't it? Others, it gives them some behaviors like going to the toilet, sitting in the toilet, smelling, all those behaviors. What can we do? And what advice can we give to our communities and our parishioners? That we must be tolerant with them. Then, also there is an issue which was burning the doctor, but I think she left, whereby she was asking us, in a case where there is rape, and there are these people who are rape and maybe defilement, we as religious leaders, what do we do? One, sometime back during COVID, we had a program in Tororo here, and it was led by the Orthodox Church, Tororo and this Sebei region. Because the immorality was too high in those districts, according to the survey. But we would move with the liaison officers from the what? From the central police, wherever you have gone. We were moving with the CDOs, the district, all those. So, probation officers. So what we handle as priests could be handled as priests, isn't it? Mm-hmm. But what is beyond us, you refer, and that either it is to be handled by what? Police. But you can't handle in a case where there is rape, where there is defilement. Because we had cases, for example, in the Queen district, a girl of 11 years being married. That was not our case now. That case was to be handled by police.
That actually antenatal care does not begin from the hospital. It begins at home. The moment your wife tells you she's pregnant, you are the first doctor to attend to her. So let us not have the mind of saying, we escort our ladies to hospitals. In fact, it is our responsibility as men. We only take them, we don't escort them. Many men are complaining about why children do not resemble them. It is because scientifically and by faith, that when a woman becomes pregnant and you distance yourself away from her, the child will never resemble you. So make sure my children resemble me. Make sure that when your wife is pregnant, stay close to her. Madam Jackie, these are just recommendations. These are recommendations. There is a call for us as religious leaders to love one another in order to see the aims of this call achieved. In life, I have never shared the same seat with a sister, Catholic sister. And let me tell you, my friend, I'm happy. Because of this BFHI, I'm now your friend. How I pray that this trend continues so that we look at one another as a brother and a sister. Not an Orthodox, not this one is SDA, not this one is a Muslim. Because when we do that, then we are not going to realize the goal of this.
I don't know whether this is a legal word. So you go and massage and she will feel very comfortable. And this is what the brother was saying, that why are we complaining of the resemblance, our children resembling other people in the village? Because you have distanced them, and it is now the border men and those in the village who are near them during the time of pregnancy. And therefore, they will take up the one. One, we have neglected our duty. Yeah. So God is calling upon us to love and take care of what He has placed before us.
And that
That's why even I wanted to read for you some verses, because I was thinking about it. Some of us, we are brought up with mothers. Among the verses, Allah says in the Quran that Allah is the one who created you from weakness, then after weakness, strength, then made after strength, weakness, and white hair. He creates what he wills, and he is the knowing, the competent. Which means that everybody will go through those steps. You are young, you are youth, and later also you'll be old. So you should know that. So whenever you treat well your parents, also will get somebody also to treat you when you come to that stage. Here God said that pregnancy and breastfeeding, both of those things, they take 30 months. And then in another verse, he talked about breastfeeding only, that it takes 2 years.
It's done to help you grow well, mentally, physically, physiologically, spiritually. And that's why you are planning for the older age. Not beginning when you are old. Some of you discussed retirement. Is it in this group? Yeah, I think so. You must prepare, therefore, to retire, but retire into a lifestyle that supports healthy aging. Otherwise, you'll find it very difficult to do what? To get off the busy schedule. So, government programs have mainstreamed aging into the different government ministries.
A long queue, where Madame, when she would go, she would leave at 8, comes back sometimes even at 4 a.m. or maybe 4 p.m. But when I started going, you know, you will give your wife money. So we don't be waiting for God for people. But when you go yourself, there are small costs that you will incur, which you may not give as provision. So when I would reach out to the nurses that worked on us, I would give them a tip. So we developed a relationship with the nurses. And now what they will do, instead of us coming to queue, they will call us, we don't come on the queue. We shall call you when the numbers, what? Has gone down. So they will call us when there are about 3 people left. By the time we get to the hospital, we are probably just waiting for one person and we get in. And up to today, we see numbers. Some of those nurses were transferred, some of them got better jobs and left to Europe. But they still call them, sometimes they forget the girl's birthday. But 4 days the birthday, someone is saying, hey, how is the young girl? I'm sending something for her birthday. This is a nurse who was doing antenatal.
To the capacity and capability that you have according to the general environment. If you are rich, use the richness you have to make her happy and to maintain the baby and all those things. So we should do help the wives of ours when this when they are very weak. The Prophet said, a man should take care of his wife even when they're performing their sexual matters. You have to go slowly. Don't harm her. Our younger ones who use drugs and do things anyhow. It's not allowed. The Prophet, peace be upon him, used to watch for his wives. Used to pay certain clothes and others for his wives. And the Sahaba were wondering, that's the way to go. So for us, I don't know what we do, but we should encourage our followers to give enough help to give the wives of other hours, especially from the Quran in Surah Al-Falaq. I think tomorrow we shall put everything in writing. Yes, please. Allah says that أَسْكِنُوهُنَّ مِنْ حَيْثُ سَكَنْتُم مِنْ وُجُدِكُمْ. He was talking about the wives addressing the men. that sleep where your wives sleep. Let them sleep where
you are.
Don't sleep far and maybe you say after eating things then you go away. How to be there with her. Then he continued and said, do not harm them in any way. And maybe somebody feelings, you cannot harm her at all. Then God continued and said, وَإِن كُنَّ أُولَاتِ حَمْلٍ فَأَنفِقُوا عَلَيْهِنَّ حَتَّى يَضَعْنَ حَمْلَهُنَّ. When they are pregnant, make sure you spend all necessary and possible money on their well-being when they are pregnant. These are commandments. And of course, when you spend money, of course, you have to do other things that are related. Then he continued and said, فَإِنْ أَرْضَعْنَ لَكُمْ فَآتُوهُنَّ أُجُورَهُنَّ. After delivering the babies, make sure that when they are breastfeeding your children, you pay them. This is a commandment in Islam. We pay women when they are breastfeeding our babies.
Because Ministry of Health, as Dr. Olin said, realized that most of the healthy seeking behavior, one, men themselves are not good at seeking help. But also because they are the decision makers, if they are not converted, then their families will not seek healthy services because they are the ones even who finance it. So men engagement is a cross-cutting, but like any other mainstreaming factor, if we don't give it responsibility, it dies. So what we agreed in the previous engagements, and I'm glad Prince has hinted on it, and picked interest, we gave it to the leadership of the kingdom. So Soka Kingdom, though for them they already have a running campaign of Sadapa or something like that. So they agreed that I think it's Reverend Chapino said that we are working together. So we are going to have it as one of the cross-cutting activities, but we need to provide leadership. So our culture leaders, Miode and Dola that are here, are you, because you are beginning to center responsibilities, for us not to lose that, are you able to provide leadership on that, so that when it gets to whatever we are doing, you are accountable, and for you keep an eye on that. That will be easier than, we are going to have it actually. Every activity is going to have an engagement, because it's a barrier to whatever we want to achieve. But if we can agree that the kingdom set the leadership of that, to help us continue to have that oversight role, it will help us because it has also a lot of both cultural and religious connotations. But
the third, time comes that it becomes weak, and it can no longer hold. That's why women bleed to death, and they die, by the way. Every Monday at Ministry of Health, we review women who die in this country, and the number one killer is that bleeding, what is called postpartum hemorrhage. And how does it happen? Those are the things.
Postpartum
She has
hemorrhage.
overproduced, the uterus is now weak, too many problems. Now that's why we are saying these women should not give birth too frequent, too soon, too late. Okay? Now, the reason why you're here today, it is you to take that message. The Quran may talk about that, no, I'm straight. No, she must produce until the eggs are over. But look at the health part of it. Yesterday I told you, I'm here to talk about health, not faith. Because I'm interested in seeing women alive. Yes, that's why you're here. So that me and you, we compromise. Okay? As you quote the Quran, the Bible, and then the health perspective comes in, we agree that now we want to go out
as Muslim, as Catholic, as Reverend sisters, as reverends in the Protestant church, and as pastors. How do we harmonize this and make sure we still have the women alive?
Yes.
It is so painful for a woman to die to leave you with 8 kids.
And agree on priorities. There are 6 areas of self-care, but we need to agree in terms of what are our priorities. Maybe 3 that we want to say, come 2026, we are going to concentrate on this. So that will be now the regional for the religious, and then the Prince. We are also going to come up with an action plan for the culture, and since you're coordinating the rest, maybe that's something we need to start thinking about. Is the minister here today?
Minister of Health.
Doctor is around. So he needs to capture all these, since even the Prime Minister is coordinating other kingdoms. You will come up with an action plan, which already the discussions are happening. I'm sure they'll be continuing. So if you feel that as a kingdom, sickle cells is one of the things you want to concentrate on, then we can take it on. And so we might not do everything in the shortest time, but let's prioritize and say, for us as interfaith regional, we are going to handle 1, 2, 3 things. But from those, you're also going to have your own district. Because each district is unique, you might have to even say, for us, even when the region is this, but for us, we want to run with this issue as a district, because we are going to form our networks. The 4 of you or the 5 that came, when you go back, you'll be your own committee at the district. So start thinking about, as we discussed, start thinking about what are those issues. We cannot do everything. But in an honest priority, we might not do all the things we've mentioned. But for example, if you talk about mental health or non-communicable, we can say under that we are going to do 1 thing or 2 things. There can be 100 things, but we cannot do all of them. That way it will be easier for us to look back. The fact that even we don't have very clear resources right now, it's not a project that normally we get projects where it's 1 year is funded, and then we are going to fund you, and you know when you need to go to these homes, you will have fuel.
Human is a family. Don't go and blaming the teachers, what and so on. What have you done as a family? Family. That is the first school of every human being in the world.
So I'll ride on the existing protocol and what the doctor asked. You know, we are living in a world with very many preventive diseases, but at times we are not aware. And as parents, it is our responsibility. But it's unfortunate that some of the parents even resist what is good for your child, so that your child is healthy, your child is protected from particular disease. Now we are talking about the younger girl. We have this animal called cancer. Cancer is killing our people. We have different cancers. Cancer of the breast. Why there have been many now? Cancer of the uterus, cancer of the cervix, cancer of every part of the body. We have those cancers. But they are preventive. Now for our girls, we came up with a vaccine, what we call the human papillomavirus vaccine. In short, we abbreviate it HPV vaccine. And we are supposed to protect these girls at 10 years. The right time is at 10 years, where we feel this girl is still really not engaged in a lot of sexual activities. So that we protect this young girl against this deadly disease. We are now picking them. We do a lot of screening, but we are getting these girls at 20, that age, 20, 22, 25, already with signs. So parents, these services are free. These vaccines are within our own health facilities. even outreaches in our communities. So I was to encourage you. You have all these congregations in the mosques, in the church, where the cultural leaders in our communities. Let's speak to our community. You're talking about self-care. Let's protect our daughters. Tomorrow we need this card from these girls, not so?
Yes.
Yes, who will take her when she's already infected? Who?
No.
So, we are here to learn and implement. Thank you very much.
It is very, very interesting. I have lived simple life. When I say simple, there's no way, like the natives sometimes have to say they have to go for some medicine in order to be healthy, in order to be lucky. I've grown in a Christian family, and all that I do, when I wake up in the morning, I thank my Creator for having given me a night. At the same time, pray that the day that has just broken will be equally a blessing. And with, as I say, proper feeding. Which my wife has always been, especially when I was still alive, would take care and ensure I have good meals and on time. Besides that, I like doing exercise. I think this I inherited from my school days. I used to participate in a number of voluntary things like scouting. In Namilango College where I went, we were being trained military sciences, and therefore the drills, running around, so as not to keep idle. I hardly keep idle. If I have nothing to do, I'm not reading, I would rather take a walk around. I also love nature so much. Every plant I see seems to please me because when they mix 3 or 4, they make a good scenery. And that has been a part of my life. I do not want to stay all lonely. I will make sure there's someone around. If there's nothing around, as I said, I go to a field, watch the flowers, and almost speak to the flowers and say, how did you become so beautiful? And of course, the plant would not shroud.
Even birth and take care of her. So we have come up with parents of noble character. And these are the activities that they do. First of all, they stay with their families. Secondly, they have established what they call a circle they call Women with a Mission. Their purpose is to make sure that they sustain themselves economically so that they can support their families. Much as some of them have got extra challenges, but at least we have tried. Lastly, we have got a youth program called Youth for a Purpose. Like now, we are going to have a retreat in January. Every other year, we have a retreat. The whole church, the whole ministry, we identify somewhere, somehow, we bring these people, we train them, we review what we have done in the past, and then ask God to give us direction. So I have realized that I was doing something, but which was broken. Now I'm going to consolidate this together. And much as it's only the school which is registered, but we are going to bring all this program together and we register it.
country, and God willing, very soon this model is going to be benchmarked in other countries. Before I go ahead, I would like, before you Minister, the Prime Minister, to appreciate this kingdom. When we announced that we are bringing this day here, without even any arrangement, the Catholic Church, they had a dedicated ministry to talk about male engagement. The other day, we were with a bishop, and there was a clergy's meeting in the Rwenzori region, and they committed that they are going to make sure it's part of the agenda. And all the faith, Orthodox and the Muslims. So male engagement in the entire region is going to be a main agenda on the religious leaders' calendar. And we appreciate the interfaith connection and the network in the region. I will not talk about
acquire most people are from, even in school, not in neglect school. That's where the community is. The kingdom and the people are not in mutual or elsewhere. They are within the classrooms, and churches have managed to penetrate those areas. So it's very, very important that religious institutions qualify this message, amplify it, and ensure that everybody listens to the clear messages that we're sending out. Men are leaders, but the women are equal partners. So how do we create that equity? Over a period of time, we have been promoting the girls' health, and I believe that it has eroded the thinking regarding men as equal partners in this relationship.
Prime Minister, how do you think organizations like Faith for Family Initiative and other faith institutions can collaborate with the kingdom to make sure that we address issues like HIV prevalence is high in the region, teenage pregnancy, and many others? How can we collaborate together to make sure that we address these issues?
My administration has been very clear. We are seeking for meaningful partnerships. As a kingdom, our vices are not as much as if we partner with other institutions such as the Fight for Families. And I believe that if we work together in partnership, I have strengths that I'm bringing with my administration, and you have strengths that you bring. And if you combine those efforts, the outcomes are formidable. Thank you very much. Thank you.
Precious name of our Lord and Jesus Christ, from the clergy, Mother's Union, Father's Union, and the entire Christian community of Rwenzori Diocese. Today, on this historic International Men's Day 2025, we gather on this holy ground of Uganda Pentecostal University, celebrate men, not just as heads of families, but as builders, protectors, and role models for the next generation. The theme, men building a generation of health, economically empowered and violent-free communities, speaks directly to the heart of the gospel and to the urgent needs of our total kingdom and the Rwenzori region. We thank God for the visionary leadership of His Majesty King Oyo, who has already shown the nation what positive male role modeling looks like, speaking boldly to young men, mentoring them, and challenging them to reject violence and to embrace responsibility. Your Majesty, we are proud that the United Nations recognized your efforts in Busoga. Today we pray that the same fire will burn even brighter here in Toro as we launch the Abaseja Emansia Toro platform. We shall use our structures and preach and educate that a real man accompanies his wife to antenatal care. We shall teach our sons to protect or planning. Your family is not a weakness. It is wisdom and love. We shall open the doors of our churches and mosques for mental health counseling, because a strong man is not ashamed to say, I need help. We shall stand with our cultural institution and say no to defilement, no to HIV infections, no to teenage pregnancy, no to gender-based violence. We commit in this region to work hand in hand with the Catholic Church, the Muslim community, our cultural institution, and organizations like Faith for Family Health Initiative, 3FHI, and the Western Uganda FBO network and other NGOs stroke CSOs to make every parish, every mosque, every home a center of health, empowered and violent-free living.
On this International Men's Day 2025, under the powerful theme, Men Building a Generation of Healthy, Economically Empowered and Violence-Free Communities, we, the Muslim community of Toro, stand shoulder to shoulder with our Christian brothers and sisters, with His Majesty's Cultural Institution, and with all the people of goodwill to say loudly and clear, a real man is a mercy to his family and to the society. The Quran says in chapter Rome, that is Rome, chapter 30, verse 21, that among His signs is that He created for you mates, and from among yourselves, that you may find tranquility in them. And He has put love and mercy between you. The meaning of the word tranquility is a state of being calm, a state of being without worries, so that we can have a peaceful community. Too many boys grow up without fathers who teach them that strength lies in controlling anger, not in raising a hand against a woman or child. We do commit ourselves to preach in every sermon that taking your wife for antenatal care is also an act of worship. We will teach our sons that planning for your family with wisdom and mutual consent is also part of the traditions of our beloved Prophet, and also it shows a responsible manhood. We will also open up the doors of our mosques, the doors of our institutions for mental health counseling, because asking for help is not a weakness. It is a courage and trust in God. We say a firm no to defilement, teenage pregnancy, gender-based violence, and all forms of oppression disguised as culture. We also pledge to deepen this interfaith partnership. We will ensure that every leader under the mosque in Toro is equipped to speak confidently on safe motherhood, adolescent health, non-communicable diseases, and positive masculinity.
Thank you so much, the religious community.
By sometimes peer pressure. The boys have a lot of peer pressure which take them to use drugs. Another thing can be a parent-child love. Very many parents there at our homes don't talk to their children. You find that a parent is coming from home like in the morning and comes there in the evening, and they don't get a lot of time to talk about their connections. The day-to-day life, they don't talk about it. So you find very many boys have started using drugs, mostly they are deceived by the age. When they get into the age like 17, 18, 19, they start coupling. They start getting guys, they do sex-related issues, which let them nowhere. I also have my colleague who will say something about this. Thank you for listening.
On this occasion, for me, I'm here to talk about poor mental health in boys. We as boys, we are facing a problem of mental health, and this is all coming from family-related causing. Our parents do not have love for boys. They only show love to girls. Even when it's like supporting in our schools items or requirements, you see a girl is given everything like a pocket money. If they are giving you pocket money, a girl is likely to be given 50, where a boy 10,000.
Child to be emancipated, the male child has been neglected. And we forget that these male children are the husbands of the daughters that we have empowered. And so we need to roll back and cater for the boy child.
We are right now looking at consolidating the gains through the many tools that we've been able to develop, through the capacity of the different interfaith religious leaders and sector actors, through the leadership that we've provided and the representation. We are aiming at consolidating the gains as we advance and scale up in different areas. We appreciate all our donors who have enabled us to implement over 12 projects for the last 8 years, including USAID, World Bank Global Financing Facility, Population Action International, the New Venture Fund, FP 2030, Comic Relief, Gavi, PATH, Ministry of Health, among many, even those that we've not been able to mention. We've been able to see that this model is appreciated, including the Ministry of Health right now that looks at Faith for Family Health Initiative as an anchor organization when it gets to mobilizing and engaging sectoral actors, including the interfaith religious leaders who we've trained as champions of health. Going forward, as Faith for Family Health Initiative, both the governance, the leadership, the secretariat, together with our partners, we look forward to advancing 3FHI mandate of better health for all and ensuring well-being through faith, and that will be through expanding, consolidating our gains that already have been highlighted in the video, but also scaling up our work across Uganda, ensuring that we have more champions who are mobilizing communities, who are creating demand, who are influencing financing and policy. Ensure that communities are mobilized, they are able to demand services, and also when they are demanding services, they are able to access them. And also being able to provide tools, being able to train different actors, and also being able to support other organizations by building the capacity and the leadership that we've provided, the civil society organizations and platforms we've nurtured, the faith-based organizations that are now able to mobilize resources, have grown and have systems. All those, we are looking at how can we continue to support them to ensure that they are well consolidated, they are able to continue to get the results that were intended, but also consolidate the impact. But very, very important, we are looking at scaling up beyond 31 districts, and our next 5-year strategic plan, 2026-2027, up to 2030 to 2031, we are looking at needs to be able to cover 60% of the Ugandan districts with support from all our partners. But also we are looking at scaling up this model to realize our initial dream of the representation of the logo you see that has different colors. It represents global and regional perspective. We plan and we envision to move to East Africa, Africa, and globally, so that we are able to provide technical assistance, partner with different organizations, scale up our model, which has proven as an innovation to address healthy issues and ensure better health outcomes.